All right. Good afternoon, everyone. Welcome to our February neonatal webinar for the Georgia Perinatal Quality Collaborative. It is great to have so many of you here with us today. I'm Kimberly Ross. I'm the Neonatal Quality Improvement Senior Manager at the Department of Public Health. I support the activities on the neonatal side of GaPQC. We're going to go ahead and get started. We have a lot of information for you all today. So we want to make sure we have enough time to get through all of it. I wanted to start a little bit because while many of you are familiar with GaPQC because you come to our monthly webinars and you've been doing NAS and our other projects, I know there's some people who are new to GaPQC. And so quickly, I just wanted to give an overview of what it is. GaPQC, or the Georgia Perinatal Quality Collaborative, is a network of perinatal stakeholders working together to improve the quality of care and outcomes for Georgia mothers and babies. GaPQC leads statewide implementation of quality improvement initiatives through technical assistance, quality improvement training, education, and data support to hospitals. Since 2012, hospital teams across the state have been working on initiatives focusing on most recently neonatal abstinence syndrome on the neonatal side, newborn screening for critical congenital heart disease, antibiotic stewardship, and then postpartum LARCs, obstetric hemorrhage, severe hypertension on the maternal side, and others. Of the hospitals, perinatal hospitals in Georgia, 63 participate in one of the initiatives of GaPQC, either on the neonatal side, maternal side, or both. We wanted to talk a little bit about the Emory Breastfeeding Conference, and I was going to hand it over to Claire Eden to give you a little bit of information on this upcoming conference.
Hi, everyone. I'm here representing the planning committee from the 32nd Annual Conference on Breastfeeding, presented by the Division of Neonatal Perinatal Medicine at Emory University and the Children's Healthcare of Atlanta. I see some of our other conference planning committee members on the call. So we've been hard at work prepping this for to kind of uphold our standard. Unfortunately, we will be meeting virtually again this year, but we hope that that'll be a plus and make it easier for a lot of folks to attend. And we have a two-day, as usual, a two-day conference planned for you all. It'll run from about noon to 5 on Monday, March 7th and Tuesday, March 8th. And the first day, we have kind of an emphasis on human milk science. We have some national faculty presenting, Marsha Walker, who's big on the lactation lecture circuit. She's going to present the first of her 2 talks, and the first one is on chrononutrition, which is kind of a hot topic in research right now. And then Dr. Lars Bode will present 2 talks, one kind of related to COVID, and then a second on human milk oligosaccharides, which will be really interesting to kind of see that interplay between mother and baby. So that's our day 1 agenda. And then on our second day, we'll have an emphasis more on equity policy and advocacy. The day will start with a panel of a kind of representing a lot of different lactation care providers. It'll be moderated by Dr. Betsy Collins on accessing the layers of lactation care. And then we'll have 3 kind of more heavy-hitting talks, one from Zakiba Henderson on quality and equity, our second talk from Marsha Walker on infant formula marketing, and then we'll wrap up with Dr. Allison Rose on advocacy in the NICU for donor human milk. The conference will be on the Excel Events platform, so there'll be some opportunities for networking, and we hope that a lot of you will join us. Registration's open.
Great. Thank you, Claire. And so we wanted to share that in lieu of our March GaPQC neonatal webinar, we are going to support 70 registrations for the Emory Breastfeeding Conference. So I'll be sending out an email that will have a code in it that you'll use when you register for the Emory Breastfeeding Conference, and it'll make it free for you to attend. So we'll have 70 GaPQC sponsored spots for that conference. So as soon as you see that email come out with that code, go ahead and register. We want to support as many of you as possible attending that conference because that information is going to be so valuable as we move into our next initiative that is focusing on human milk, on nutrition. And so many of those topics are going to obviously feed into the work that we're going to be doing. So look for that email. It will come out. If you have any questions, you can, of course, reach out to Claire or to me, but you'll see that email come soon with that code. So don't register until you see the code because you'll save $100. So another update, there is the also Emory NICU Imprint Conference, Impact of Social Determinants of Health on the NICU. That conference is coming up in May. We plan to do the same thing where we sponsor registrations for that as well. So we'll get through getting people registered for the breastfeeding conference, and then we'll work on doing the same thing for the NICU Imprint Conference for those of you that would be able to attend. I believe it's only in person. I didn't see that there's a virtual option. I think Kim Case is on here, so if anyone knows differently, let me know. There, I see a hand raised, but I can't see who it is.
It's me, it's Kim.
Okay.
It's Kim.
It's actually May 12th. I think that was just a little typo on that.
Oh, sorry.
It's okay. I just wanted to clarify while people are on here. And it is going to have a virtual option and an in-person option.
Perfect. Wonderful. That gives
I'll put the website in the chat.
Okay, wonderful. Thank you, Kim. That gives access to a lot more people because I know some people are still limited on the ability to travel. So it's great that there's virtual and in person. So we'll be supporting registrations for that. So, but I'll give more information as we get closer to that. Also, some more save the dates for the Georgia Perinatal Association annual conference. That's in September, and then the GaPQC annual conference is in October. So we'll probably have that on every slide until then. So you'll probably get tired and those dates will be burned into your brain. But can't wait to see you there. Great. And we're going to move into the content of our webinar. We have Dr. Ravi Patel sharing with us first. He is an associate professor of pediatrics at Emory University. You can mute. Hang on, I'll mute. All right. He's a associate professor of pediatrics at Emory University School of Medicine and Children's Healthcare of Atlanta and serves on the leadership committee of the Georgia Perinatal Quality Collaborative. He received formal training in quality improvement through the Emory Healthcare Quality Academy and the I2S2 course at Cincinnati Children's. He has led multiple improvement projects, including efforts focused on improving vitamin D supplementation, the timeliness of hepatitis B vaccination, critical congenital heart disease screening, care during the golden hour, decreasing necrotizing enterocolitis, and antibiotic stewardship in conjunction with the Vermont-Oxford Network. Dr. Patel is a principal investigator in the NICHD Neonatal Research Network, a scientific advisor to the NEC Society, serves on the executive committee of the American Academy of Pediatrics section on neonatal perinatal medicine, and the board of the International Society for Evidence-Based Neonatology. I will hand it over to you, Dr. Patel.
Thank you so much, Kimberly, for that introduction, and hi everyone. I'm really delighted to be here and to share with you some of what we're going to be excited to launch in the coming months on optimizing nutrition for Georgia newborns. And I along with David Levine, co-chair the neonatal arm of the GaPQC. It's exciting to welcome some new names to this webinar, and we really are happy to continue to be growing the GaPQC in our neonatal journey, where we're just finishing our project on neonatal abstinence syndrome and moving into this next project on optimizing nutrition. We had wonderful engagement. 46 hospitals in Georgia participated in the NAS project, and we really want to continue the engagement and learning that has gone on. So I'm going to talk a little bit about the Optimizing Nutrition for Georgia Newborns project, and the goal is to launch in June. We kind of had a reset with the impact that we were hearing from many of our hospitals with COVID-19 and staffing, and so we decided to kind of slow down and give some more time for hospitals to consider this initiative. We've had a number of hospitals that have expressed interest, and we've had to discuss, and we're glad that many of you can join, and we hope to answer questions that you may have about this initiative, with the plan to launch in June We're going to have a lot of things in between. You heard about the Emory Breastfeeding Conference in March. That's a great way to hear some really leading experts on breastfeeding. Zakiba Henderson is going to talk about something very important to what we're hoping to do on equity. And then in April, I'll share what we'll have another topic tied into this with the launch in June. Why do we need this? And for many of you, this is not new. This is areas that you or your hospitals have been working on. And I think one of the areas is really, our own report card in Georgia of how we're doing with newborn nutrition. For those that joined our GaPQC annual meeting last year, you heard Krista Marks from the CDC share really the latest data on a report card, which I think highlights very specific opportunities that we have in Georgia to improve newborn nutrition. And in April, we hope to have Krista Marks back in one of our webinars to really refresh on what we are doing in our Georgia hospitals in terms of our practices and where there are really very data-targeted opportunities for improvement. And one of the things that was highlighted was where less than 40% of Georgia hospitals were doing well in areas such as separating babies from their mothers for routine newborn procedures, for example, blood testing, formula feeding, and written policies. And I think these are just 3 areas that we think we can really try over the next couple of years when we launch this to try to see if we as a state and as a collaborative can move the needle on. You'll hear a lot more of this in kind of a more detailed webinar that dives deeper into our MPINC reports, which are done by the CDC in areas and kind of where we're doing well and where we can improve. So how can we as a state, as a collaborative, improve? And I think one of the things that's really exciting about the Georgia Perinatal Quality Collaborative is you get to work with a lot of peers on common goals, learn from each other, share policies, and sometimes reduce some of that friction and barriers that are related to improvement. And we think that using good methodology in addition to providing expert content really meshes well in terms of trying to move the needle on what you as hospitals want to improve and specifically on targeted areas that are part of really a holistic improvement in nutrition. So we have 4 major pillars of this project. The first is that it's going to have quality improvement as a core. We want and need data to try to drive improvement, but we don't want this to be a data collection project. And we've been very specific as we've looked at what other states have done in terms of improving nutrition, other peer states and their projects, and really try to be very pragmatic with trying to have just the minimum of data to say, are we improving care? We want this to be applicable to all the birthing hospitals in Georgia, which means this could be applied to the neonatal intensive care unit in your hospital, the mother-baby setting, or potentially both for hospitals that have both settings. And we want flexibility because we know that hospitals are impacted by staffing challenges with COVID-19. We want to give the opportunity for centers that are really eager to improve to join on and work with us on improving care. We also want individuals in hospitals that might not quite yet be ready to also be welcome to participate and to learn. And I'm going to go into this just in a little bit more detail. In terms of quality improvement as a core, for those of you that have been part of our Vermont-Oxford Network Initiative, this will look very familiar in terms of a key driver diagram of what we're trying to achieve. And what we hope is over the course of 2 years is to really try to address a lot of the drivers that are necessary to improve nutrition and human milk feeding in your hospital settings, and to really give you a lot of very practical take to your unit change ideas and interventions that could change to help you improve care, and to have monthly webinars as well as self-paced content that touch many of these interventions. And Claire's going to talk a little bit more about what we have lined up for the second half of this year as it relates to this. And this will be following a very similar approach as what we did with the NAS initiative over the last 2.5 years. We also realized that you need data to know if the changes you're making are going to lead to an improvement. So I think that data is absolutely critical to know if, as you make improvements in your care, are you actually moving the needle on the processes and outcomes that you want to see improved. But we also want this to be an improvement effort and not a data collection effort. So we've been really very intentional in terms of making a minimal amount of data collection for those in your hospital that are doing this. This might be something else that's added to the list. And our goal is to really have hospitals spend no more than 1 hour each month on what's essential data collection. This is just a snapshot of the approach we're taking, which is an audit of 10 infants in a unit, very similar to the Vermont Oxford Network audits that some of you might have been participating in with our NAS initiatives, focused on what we think are 3 measures. And these measures went through several months of going from a larger list of what we thought were 3 essential measures, looking at what other states were collecting, what we think are things that can be really amenable to improvement efforts, looking at what babies are getting as a first feeding, timeliness of expression and feeding, and then any formula exposure. And this is really the core elements of what we want for the hospitals that participate and choose to submit data. We'll have optional data that will launch as we get started, that will involve a little bit more granularity, but that will be optional for hospitals that want to add in, that might collect a little bit more detail on some of the characteristics to try to address potentially some disparities that might occur with some of these measures. And we have a red cap. This is what our maternal and neonatal initiatives are using, which will allow, in a very similar way as a survey, entry of this data that will not have any identifiers, that will be submitted to the GaPQC once a month. That will involve dates in which you're assessing this, some information about the location, and then the measures that I showed before. So we really want this to be very simple, very pragmatic, and this will be repeated on a monthly basis. And the goal that what we will do is then allow you and give you tools to try to understand, are you moving the needle? How can we look at this and learn from this information and guide improvements? Now, this is the core. For some hospitals, they may be very interested in building onto this and collecting additional information on specific aspects of change ideas or interventions, and we would encourage that. And I think the truth is, are you actually moving the needle? And this is an area where I think our country, our state, hospitals have been working on for many years. And we think picking specific practices on that key driver diagram I showed and really motivating teams to work on very targeted improvements, I think there's lots of opportunity that we can show some improvement. And for many centers, this work will span beyond 2023. This can be in any setting. We want this to be applicable to the variety of birthing hospitals in Georgia. So as I mentioned, this will be in the mother, baby, or NICU. And at the end, Kimberly will go through the enrollment form and how you can indicate for those hospitals that are interested in what settings you might choose to participate in. And for some, that might involve being as part of both settings. And then finally, I wanted to highlight that you can join only to learn. We've had a fantastic engagement with our neonatal abstinence syndrome or neonatal opioid withdrawal syndrome project, and we really want to continue that for people who really want to learn with in a collaborative. Based on that, we have 2 tiers which are focused on improving and learning. And so for the active improvement team, I'm going to share 3 of the requirements for those hospitals that want to join in, that want to improve and move the needle. But we also want to have the opportunity for both individuals and hospitals that want to join as a learning collaborative and might not yet be ready. We're still considering about whether to have kind of an improvement project or team related to this effort. So for active improvement teams, we wanted 3 practical requirements. The first is to have a project champion that's going to be the primary hospital contact for this initiative, as well as either a physician or an advanced practice provider that may not be the primary champion, but that's going to be part of the team. And that's because in other states that have taken on this effort, that's been one of those ingredients that other states have highlighted as being very important. We want some demonstration of hospital support, which could be either a senior leader, a unit director, or hospital administrator that supports the hospital's involvement. We know many of your hospitals have already been involved with the GaPQC, so this might just be a continuation of your hospital's relationship with our collaborative. And then the third is a commitment to tracking and submitting limited data. We want this to be as minimal as possible, but we really think this has to be part of if we're going to improve, we need to collect some limited data. And so these are the three requirements for active improvement teams. Now, for learning collaboratives, we want the opportunity for centers that might not be ready or are still considering, or maybe for individuals that are interested in joining that might be traveling across many different hospitals and would like to join and learn. And this would involve the opportunity to join our monthly educational webinars or annual meeting to learn alongside the collaborative. There'll be no data submission and no QI coaching. And so we do want this to be an opportunity. And part of this is because of really the amount of what we've seen with our prior initiative in terms of how many staff really took advantage of our learning in the last initiative focused on neonatal abstinence syndrome. We had almost 2,000 staff at 45 hospitals that engaged in our educational content, almost 16,000 tiny kind of bite-sized lessons. So lots of learning that happened in Georgia and across our hospitals that were related to our prior initiative, and we want to offer the opportunity for our hospitals to continue that with this initiative. You've probably seen this, and if you are interested, I know Kimberly is going to share this at the end as well. Please reach out. You can also take a snapshot with your phone of this picture and share. This is just an interest, and with this, we have your contact information. We can give you more information about enrollment. And with that, I'm going to transition to. We really have a fantastic partnership with the Georgia chapter of the American Academy of Pediatrics, and really two experts who are going to be supporting a lot of this initiative and helping us with content, Claire Eden and Taryn Fairley. And so I'm going to transition back to Claire, who can tell us a little bit more about kind of what we have planned for the next half of the year.
Thanks, Dr. All right, we have, as Dr. Patel mentioned, Dr. Fairley and Claire Eden to talk a bit about the educational portion of this initiative. Dr. Fairley practices general pediatrics and breastfeeding medicine at Kaiser Permanente. She's a member of the Academy of Breastfeeding Medicine and adjunct faculty at the Emory University School of Medicine. She currently serves as a physician chair of the breastfeeding committee at the Georgia chapter of the American Academy of Pediatrics and is the chapter breastfeeding coordinator. Claire Eden is a board certified and licensed lactation consultant. She directs the breastfeeding initiatives out of the Georgia chapter of the American Academy of Pediatrics, including the EPIC breastfeeding education program. She also serves as president of the Georgia Breastfeeding Coalition.
Thanks, Kimberly. Thanks, Dr. Patel. As mentioned, we're really pleased to be partnering with the GaPQC on the educational portion of this new initiative. And as you can see, we have a lot planned. And I'm going to share, Dr. Fairley and I are going to share a little bit about what we are working on that will be the 2022 portion of the program. Each month we will kind of continue in the GaPQC tradition of having an hour-long webinar, and then we are working to develop a few kind of foundational micro lessons that will be associated educational portion to prepare folks to participate in the webinar, either live or to review it later. The webinars will be the opportunity to kind of translate those educational pieces into practice, as Dr. Patel mentioned, and we'll be lining up expert faculty to kind of give on the ground and like bird's eye view of how to use that education or those practice changes to move towards your goals in your facility. The micro lessons will be available on demand, and folks can join in, really as time goes on. It's not like the opportunities will pass you by. If we have any late adopters, you'll be able to kind of catch up on your time frame. And then we are going to start 2022 with sort of supporting the normal course of lactation for the healthy term dyad. And then as the initiative moves on, we'll be expanding into more NICU specific education. Dr. Fairley.
Great. Yeah, so our first webinar planned for June, kind of getting a landscape of breastfeeding as a public health issue here in Georgia, re-engaging a little bit with our MPINC survey scores, kind of getting a little bit more specifics. We'll be sending you a pre-engagement assessment, and we'll be reviewing those results just to get an idea in terms of starting point. And we'll use this to help inform the other webinars, although we definitely have some content that's already been determined. We do want to see what interests and what needs there are out there at this point. And we'll give you some cursory, some beginning list of resources at that point to also guide your work as you start to work through the initiative. There. Oh, I guess that's moving. Yeah. So our first big content focused webinar is focusing on time as tissue. So it's kind of stealing ideas from the ICU setting, where this is a often repeated phrase. Talking about some of the urgency around early removal based on lactation physiology, and also doing some micro lessons. Again, a lot of these are going to be standalone, on demand, able to catch up at any point in time or re-review about lactation anatomy and physiology, that golden hour, and what that actually means, what's actually happening in the breast tissue at that moment in time, and why it's so critical to remove milk early, and that impact later on supply.
So then we'd like to do one on perinatal education and lactation support. So perinatal versus prenatal. This webinar would kind of focus on the different roles in the team as you approach kind of changing the culture in your unit. We want to be providing some really hard examples of scripting and how to document teaching, hopefully preventing, but also managing some common difficulties that arise in the perinatal period, discharge planning, and reviewing education that's used in your facility for commercial influence. So those will be some of the micro lessons that will be attached to that. Will be around responsive feeding, how to teach and assess positioning and latch, engaging partners, co-parents, support people in teaching, since we know that someone who just gave birth is not always in the most receptive state to receive education, and then avoiding conflicts of interest in infant feeding education.
All very important. Our next webinar is going to focus a little bit on perhaps a new topic, although I think there's more dialogue around this than when I started in lactation, about lactation risk assessment. Kind of doing some screening at, admission to antepartum to set up dyads for success. If you talk to anyone in lactation, we know who the high risk dyads are, but sometimes this is something that seems to be surprising on the other end of things. There are definitely known risk factors from the evidence. And then, making a plan when we do have these risk factors, helping staff to kind of have a care plan, direction, algorithm to plan ahead when things may be at risk for not going well, or for when things don't go well at all. And this would focus mostly on risk assessment for delayed or suppressed lactogenesis, or engorgement, or for poor feeding or milk transfer, or a combination therein. And then this is also good in terms of the administrative side of things, I think, for triaging clinical care and valuable lactation consultant and patient resources to that highest risk dyad that's going to have the most benefit from early, timely, skilled intervention. And so our micro lessons there will kind of focus on the parent-baby dyad, how to assess a feed effectively, antenatal milk expression, harvesting, hot topic, lots of controversy. It's coming to a hospital near you if you're like, what on earth are they talking about? It's coming down the pike, but it's also something potential that people can work into in the peripartum or antepartum space. And then, like I said, lactation risk assessment, talking a little bit more in plain language about all of these different risk factors that we're alluding to here.
So Dr. Fairley and I were talking about this webinar just today, and we were thinking that really a good name for it would be about bookending lactation care, the prenatal education piece, and connecting that to the continuity of care and safe discharge planning. That those two pieces need to both be there in addition to the good care that's being offered while the dyad is inpatient. So we wanted to kind of present some information in the micro lessons around kind of going beyond just the benefits of breastfeeding in the prenatal education and really hitting some of the top 5 prenatal education points that are going to really move the needle and helping folks understand how to reach their breastfeeding goals. We kind of want to go beyond the basics that we've been hearing. You know, some of us have been in this field for a long time. We want to provide some scripting and provide kind of identify education opportunities in the antepartum period. Thinking through how to coordinate messaging with OB clinics that serve your hospital, the WIC clinics where some of your patients may be receiving prenatal education. And then, of course, if your hospital's offering prenatal education, getting all that messaging coordinated with what folks that are providing care while the dyad is admitted. So the messaging all lines up. And then coordinating discharge for, you know, safety, right? And that it's going to connect to some of those earlier webinars around assessing lactation risk and things like that to make sure that we have a warm handoff and we're bookending that care with the prenatal and the warm handoff at discharge. One of the micro lessons we're planning for this is kind of we've been getting great input from our OB partners on the breastfeeding birth plan. So we're excited to get that out into your hands. And then the walking through discharge planning and how to make sure that folks can find those referrals in their discharge packet when they're home on the second night with a crying baby.
Right, and our next webinar will feature Bermudian, which I can almost sense the groan that goes throughout the audience as I say this. It is a fundamental part of modern maternity care, but one that's much maligned, but it really is a great opportunity for a lot of things. And it's not just about staffing, which is what I had facetiously recommended that we call this, because that's often kind of the thought process that maybe we just don't have staff for a nursery nurse, and that's maybe why we're putting babies in the room. No, it's a great time to, you know, model safe sleep, teach and engage mom's partner, teaching them at the bedside to recognize effective feeding, and learning in a supported setting how to provide respite for a tired birthing person. Honestly, and that helps promote safety at home. So our micro lessons that we're playing on that are responsive feeding, safe sleep and breastfeeding, and feeding effectiveness. And finally, this is you, Claire, or me? I can't remember.
I'm looking. I think this one's you. Oh, wait. Is this exclusivity? Sorry, I'm looking at notes. Yeah, this is you. And yeah, somehow they got swapped around.
Yeah,
so.
Sorry about that. Yeah, so finally, exclusivity and appropriate supplementation, another hot button topic. You know, we save these as we go along. You guys get more comfortable. And hopefully we'll get good engagement on this one. There are definitely standardized protocols and policies out there about medical indications for supplementation. And again, learning to assess risk and prioritize clinical lactation care for those who might need supplementation. Like I said, we usually can tell who these folks are early. Alternatives, right? So bridging on donor milk, teaching and consent for supplementation. How does that work practically in a patient-friendly, family-friendly way? Teaching about paced bottle feeding and other safe methods of supplementation for those who do medically require it. And so our micro lessons planned for that are kind of choosing supplementation volumes, paced feeding, safe formula preparation, alternatives for hypoglycemia management other than formula, prenatal and perinatal colostrum harvesting. Like I said, it's coming. And using the NEWT tool to assess weight recovery and promote infant safety at discharge.
One thing we'd love to hear from you all as we are working on this is how important it would be to your facility's participation that continuing education is provided. So for those of y'all that are near can see your button, your reaction button. It's the one with a smiley face and a little hand raised. If you could either thumbs up or raise your hand if it would be important to your facility's participation that we offered continuing education for nurses, nursing contact hours. And also if you have any opinions on that, if you want to put in the chat. All right, great. I'm seeing 13 hands raised for continuing education for nurses, 14 hands, 15 hands. And then also we're wondering if it would be important to your hospital's participation if we offered continuing medical education or CME for physicians and advanced practice providers. I don't know, it's hard to like put your hand down and then raise it again. But if you have some messaging for us or chat information for us, we're trying to determine the role of continuing education for this education arm of the initiative. So I'd love some feedback from y'all. All right, thank you. I'll pass it back to Kimberly.
All right, thank you, Dr. Fairley. Thank you, Claire. We do want to allow some time for questions and answers, but first I want to show you all our QR code again. If you are wanting to submit your contact information on the interest form, this QR code will get you to that interest form. That just provides us with your email address, and so we can reach out to you with more information. We're happy to talk more with anybody about the initiative. You can also just email me directly, kimberly.ross@dph.ga.gov. And I'm seeing some in the chat that CMEs would be great. So we really appreciate your feedback on that. I do want to go over the enrollment form. So what you saw previously, that just takes you to an interest form where you just put information. You're not committing to anything. You're just saying, oh, that sounds interesting. I'd like to know more. The enrollment form is what we'll send out to folks when you decide to become a part of the initiative. And I was going to kind of walk through it. That way we can answer questions as we are all together. And Dr. Patel talked about this a little bit. You can, kind of standard form here. You put your hospital name. It does have a little note at the bottom that if you want to learn, as Dr. Patel mentioned, if you're as an individual, you're traveling between hospitals, you're not affiliated necessarily with a specific hospital, maybe you don't work in a hospital, but you found your way here and you're thinking this sounds really interesting, you are more than welcome to join the Learning Collaborative and attend the webinars that were just outlined and participate, go through the micro lessons. You would just indicate by checking the box at the bottom that you're just joining as an individual that you want to learn. Otherwise, you have your hospital name. If you are participating in the Learning Collaborative, you check the box for that and you put your contact information. And that's all we need for Learning Collaborative. If you are joining as an active improvement team, so that's the level that Dr. Patel outlined where there is that minimal data collection, the monthly audit of the 10 babies, that's active improvement. You would complete the rest of the form. So you would indicate which setting. And if you are being ambitious and doing both settings, which is awesome and supported, and we'd love to see it, you would do a form for each setting. So you would do your first form to indicate mother baby and complete the rest of the form, and then submit a second form for NICU because those teams might be different. And we want to know what's happening at each level. So you would indicate the setting, and then your champions that Dr. Patel outlined, signatures below, and that's all. Like, we're not trying to make this burdensome. This will be an online form that you send back to us. And we really just, this is how we will collect your information in order to set you up to receive surveys for data collection for everything in the future, all future communication, and have you enrolled in the initiative. So it's pretty straightforward, but we wanted to show it in case there are questions. And at this point, we can open it up for questions about anything of the initiative, the webinars, micro lessons, enrollment, anything. So feel free to come off chat, or you can put questions in, or come off mute, excuse me, or you can put your questions in the chat. No questions. Did a great job going through it all.
I did want to add, our goal with these micro lessons is to provide some inspiration for potential change ideas. We don't anticipate that you're going to address every single one of these. We really want you to focus on what you think is the right in the context of where you care for, and we want to support you with quality improvement principles. So one of the things that will be paired with a lot of this educational content is also very practical quality improvement principles to really make effective changes and try to move the needle on these key practices. So I just wanted to kind of mention that as well.
Thank you. And there is a question in the chat. Will data submission have an upload option versus data entry directly into REDCap?
So that will be in the same way you do a Survey Monkey. So a survey, it would be a survey form from so it'd be a REDCap survey that you would just do in terms of in the way in which you would do a Survey Monkey to make it as simple as possible. So that's the approach. And we would only ask for aggregate data, so nothing that would involve any identifiers on any of your on any individual patients.
Thank you. And there's a question about if you've previously indicated interest, do you have to resubmit? No, you do not. Thank you so much for those of you who have submitted interest. If you filled out this interest form or emailed me directly, we have you on our list as being interested. So you'll be receiving the enrollment form shortly, so you don't have to fill out the form again. But if you do fill it out again, that's fine too. Dr. Patel mentioned disparities. Will there be a mechanism for collection of patient demographics or stratifying data?
That's a great question. That's a very hot area, or a very important area. I think a lot of collaboratives are wanting to collect data to be stratified by primary language and race ethnicity. We when I mentioned, and I didn't go into detail, kind of the optional layer data collection, we do want to offer that to hospitals to be able to do that, and that is kind of what we will be building with the focus of 2023. I think we want to start with at least getting hospitals to provide a sampling of a minimal number of patients, and at least to get to that point, and then layering on that, then to try to get a sense of where we're starting. But that is very important, and that is the goal. I think that's important in understanding the disparities within our state and addressing. So there are some challenges with just using sampling in terms of doing that, and getting getting kind of an accurate picture of your own center with the approach we're taking. So there'll be a little bit of difference in terms of when we use specific data collection for that goal.
Great. Thank you. And there's a question, Claire, I bet you'll be able to have an answer for this. How does this go along with the 5-star hospital initiative?
Yeah, I mean, I hope I can answer that. We have been keeping these two things in mind as we've been developing the initiative, and we can, hope that the work done through the GaPQC initiative will be supportive of those hospitals that are participating in the 5-star, and we're going to be providing ways that that work can kind of fit together. There'll be, the 5-star program has been in a bit of a holding pattern during the pandemic. So I think there'll be an opportunity to expand on that before we start the initiative in June.
Any other questions? Dr. Patel, did you mention the Center of Excellence idea that we're going to implement here?
Yeah, I did. Thanks for the reminder, Kimberly. One of the things that we did with the neonatal abstinence syndrome was we realized that the reason we want participation is because I think all of us on this call want to improve care for the mothers and babies we take care of, and I think that is the lens is really to lead by your hospitals and your team's desire to improve care where you work. But we also realized that sometimes there's a benefit of incentives, and with the Vermont Oxford Network Initiative we just finished, we had a number of hospitals that could qualify after they met requirements of engagement as a center of excellence. And so we had 16 of our 46 hospitals that were participating in the last initiative that became Vermont Oxford Network Centers of Excellence. And we're going to carry that forward as GaPQC Centers of Excellence. And we'll have more details about kind of what the metrics of that are, but it would require a certain level of engagement by staff in your hospitals in terms of completing the educational content and participation, as well as data submission. So I think that, thank you for that reminder. That's just one of the ways we want to recognize those hospitals that go above and beyond, and we really saw some wonderful engagement in our last initiative where there was a lot of commitment, and so that's something that we're going to continue in this initiative.
Thank you, Dr. Patel. Any other questions?
I also wanted to highlight, one of the things I enjoyed the most was getting to learn what other hospitals are doing. So, we learned some very innovative things that were happening in NAS with peer counselors that were in some of our hospitals, and some other really unique approaches that I think can be a great opportunity to learn from each other. And I hope that that's one of the unique features, because some of your hospitals may have been working on this alone and kind of a very hospital-centric initiative. And with collaboratives, one of the things we really appreciate is the opportunity to learn from what other hospitals are doing. Maybe hospitals that have been working on this for a while. We can share your experiences and learn from you. And so we hope that is part of what we'll be able to continue to do, and something that we'll be highlighting as we progress, particularly in next year in this initiative.
Yes, thank you, Dr. Patel. We really appreciated when hospital teams shared their experience with NAS and the work they were doing. It was a great opportunity for other centers to learn. So we look forward to teams being able to share the practices that they are implementing in this initiative. And the education plan that Dr. Fairley and Claire outlined started, as we mentioned, the kickoff is June. But we will be having webinars. As we mentioned, the March one will be supporting your participation in the breastfeeding conference. And there will also be webinars in April and May, kind of leading up to that June start. So keep those on your calendar. Even though the official start is in June, we will have some great content for everybody up to that point. Any other questions? There's lots of hands up, but I think those are still from people talking about CMEs and CNEs, so it's hard to know if you have a question. So feel free just to unmute and ask or put it in the chat if you have a question. Okay. Well, any final thoughts, Claire, Dr. Fairley, Dr. Patel?
No, but I really appreciated Dr. Patel pointing out the collaborative nature, like really making this a collaborative, because I know we've got hospitals that are really on a lot of different places on the continuum, but everyone can identify, like not everyone has to get all the way down the line, like choosing what's important. There'll be some other hospitals that are doing that, that you can learn from each other. And that's what we're hoping to really call upon some of you all in the webinars to highlight some of the work that you've already done. So I just wanted to reiterate that.
Thank you. All right. Well, we will be sending more information about the registering for the breastfeeding conference, so look out for that. And we will be sending out the enrollment form and reaching out if you have put your information on the interest form. So we really appreciate you all attending today. If you think of questions, as soon as you hit leave meeting, please send them to me. Happy to share them with the team, and we'll get back with you. Yay, thanks, Marilyn. Marilyn's saying she's excited and looking forward to participating.
Hi, Marilyn.
All right, thank you, everybody. Have a wonderful afternoon. Bye.